I'm Dr. Moshe Lewis, and I'm a physical medicine and rehabilitation specialist. I see a lot of people who have injuries, whether it's from sports or car accidents. A lot of the people that come to me have some pain or they just want to be more functional, and that's my goal. Work with them and get them to their max. We are in a super fast-paced world at every single level, so our patients only have but so much time to put into this process of going and getting tests and going and exercising. So I feel like I'm the coach, and I call myself a pain coach many times because I have to really motivate my patients to realize that although they may have seen somebody before, although they may feel down and depressed, we can work together to overcome this thing called pain. So our first case today is very interesting. We have Joshua, who is a football player.
My name is Joshua Tatum. I played for USC for my first year and I transferred to the University of Missouri.
We see a lot of athletes because they often get injuries and are very motivated to change, and of course we love that kind of patient because they're compliant. Everything we ask them to do, they do, and then more.
In college, actually, my last senior year, I had a back injury. Herniated my L5 and S1 disc. I had surgery for spring ball, and I ended up, I just wasn't the same player after I had the back surgery.
Josh has had multiple surgeries. He did very well with an ACL, but he's young to have had such a big surgery already, in addition to a rotator cuff repair, and now most recently, in just the last couple of months, a back surgery.
Well, when I work out and, maybe 30, 45 minutes after post-workout, it starts to stiffen up on me. The worst time is when I'm waking up, getting out of bed. It's like I have to do a whole little stretching routine just to feel comfortable.
His challenge today lies that his routine in terms of his exercise is so intense and puts so much pressure on his back that we haven't had as perfect a result from his surgery. We can also focus on some of the core exercises of his abdominal muscles and some of the obliques, and also some of the back muscles like the multifidi, to really strengthen his back so that he doesn't A, continue to have so much weight to carry around, but B, have muscles that are becoming weak and causing more pressure on his spine. We'll have you meet with Mikkel, who does acupuncture, and analyze and see if that may be helpful. This is just there's some muscles in there that feel really tight.
Acupuncture basically utilizes the body's own energetic pathways to heal itself. In China, they believe in the energetic pathways, or meridians, where they say the qi, or subtle energy as we call it in the West, flows. There's literally a saying in Chinese medicine, where there's pain, there's blockage. Where there's blockage, there's pain. I take that to mean where there's inflammation, there's pain. Where there's pain, there's inflammation.
The intense people that keep our cities going, the firefighters, police officers. Varani, our next patient, is fascinating. She is in her 50s, she's a fire captain, and she looks like she's about 20.
My name is Varani Still Smalls, and I work with the fire department. I've been involved in firefighting since October of 1988.
Varani is the captain of the fire department and had to go into a building essentially through a very small window. And because of logistics, she wound up falling through that window and landing smack on her back.
I just made an executive decision that I'm the smallest person here, so what we're going to do is I'm going to go through the window because I'm going to need my medics to move in quickly and work. So when I start getting in the window and I look down, it's kind of deep. I'm thinking I don't want to go head first in, so I'm going to turn around and I'm going to let him hoist me up. I'm going to catch the windowsill and then I'm going to jump down. It's a pretty high jump, but that's what I decided I was going to do. Well, when he was trying to hoist me up and I was trying to turn around, I didn't quite catch the windowsill and I kind of went backwards through the window, slammed against the wall, and then to the floor.
That caused tremendous pain, essentially, to whip through the back of her body and through her chest cage, especially because those muscles and bones can't take as much of that movement.
It progressively got worse. I mean, it got to the point where I'm riding on the engine and we're on rescues or doing work, any type of work, and I'm telling my engineer that he needs to slow down and not hit bumps because they were aggravating me.
That she was telling me that sometimes when people hug her, it hurts. that means that she's got nerves that are at least being irritated, if not pinched a little bit, and that she's a candidate for injections. And so we talked about the fact that these injections are very small, very easy, can be done in less than 5 minutes, and help take away some of that pain.
This is the first time I ever met Dr. Lewis, and I was given a little background history on me, and it's almost as if I have been talking to him about my condition all the time, because he just hit right on the head. And these are things that my doctors really haven't tried yet.
So that as we send her through acupuncture and some more physical therapy, she won't have that chest pain that she's experiencing now. And hopefully when people hug her, it won't actually hurt.
Renee, she was just going through some coaching techniques to help me free my mind of these things, and hopefully that's going to help free some of that pain too.
So what I'd like to do with you, Veroni, is I'd like to take you through a trauma process to actually go back to the accident and back out the trauma from your subconscious mind, from your brain, so that instead of your brain reliving the accident when it's reminded by a movement that you make or something that someone asks you or pain that you feel, that your brain can't do that anymore.
You know, with Dr. Lewis, his professional background, being right on the money without even ever seeing me or knowing me, knowing exactly what was wrong, and then having Davenport come in to help with the pain threshold, and then Renee with the mind part, it all works hand in hand, and I just really believe in this program. I think it's wonderful.
I think my program is unique in that it really combines these disciplines all in one place and very accessibly for a doctor to be able to have an acupuncturist right there in the office, and we can go back and forth about treatment plans that could work, physical therapy right there, which is a core for rehab and exercising people. I can find a way to motivate patients to make a change. That's really a big part of what keeps me motivated, hoping that if I can show people that the barriers can be removed, they too will retain or get back that hope they had before. I want them to enjoy time with their family. I want them to go out and play sports if they want to. I want them to discover swimming or going for a walk if they can't do something that involves more impact. And the ability to touch people in that way and open their eyes to a different possibility, and certainly a life without pain or less pain if possible, definitely keeps me motivated. It's a challenge that I know I can mount if I keep at it.